Hey guys, it's Layla. Today we'll speak about the brain. This video is just a general review. So the brain is enclosed in a bony structure called the skull. You have a few bones joining together, fusing to form the skull. There are 8 bones, so you have the frontal, the 2 parietal from the top, then you've got the temporal, 2 from both the sides, you have the occipital, the sphenoid, and the ethmoid. The face, you've got 14 fused bones, so you've got the nasal bones, 2 on the top, the lacrimal bones beside them, 2 of them. You've got the palatine, you've got the inferior nasal concha or conchae, you've got the vomer, the nasal vomer, you've got the zygomatic bone, the zygoma or the arch, you've got the maxilla, and then the mandible. So the function of the skull is to protect the brain. Onto the lobes now. You have 6 lobes. So you've got the frontal lobe, which fits into the frontal bone. You've got the parietal lobe fitting into the parietal bone, the temporal lobe for the temporal bone, the occipital lobe for the occipital bone. Then if you go deeper, you will see the limbic lobe, and then you also have the insular lobe. The cerebrum is the higher center, so it controls emotions, behavior, reasoning, logic, creativity, etc. There are 2 areas in the brain that is important. So you have the Broca's area in the frontal lobe, and this area is concerned with speaking. So if you, due to a trauma, if you had developed a problem in this area, you're going to have Broca's aphasia. A patient with this kind of disorder will not be able to speak properly and will not be able to write properly either. Another area is Wernicke's area. It is in the temporal lobe. If you have a problem in this area, the patient will be unable to speak meaningful words or sentences. They will not make sense. So remember Broca's and Wernicke's areas and aphasias. Moving on to deeper structures in the brain. So we spoke about the telencephalon, which is the cerebrum. Then you have the diencephalon, then the brainstem, and you have the cerebellum. So the diencephalon consists of the thalamus, the hypothalamus, the epithalamus, and the subthalamus. The brainstem consists of 3 structures: the midbrain, the pons, and the medulla oblongata. Now the cranial nerves, there are 12 pairs of cranial nerves. We'll run through them in a bit. 10 of them emerge from the brainstem and 2 of them from the cerebrum. All right, let's run through the cranial nerves quickly. So 1 olfactory, 2 optic, both of them from the cerebrum, 3 oculomotor, 4 trochlear from the midbrain, 5 trigeminal, 6 abducens, 7 facial, and 8 vestibulocochlear from the pons, 9 glossopharyngeal, 10 vagus, 11 accessory, and 12 hypoglossal from the medulla. Back to the structures for a little bit about the function. So the diencephalon has different structures. So the thalamus is a relay center for a lot of the pathways in the brain, and those coming from the spinal cord. The hypothalamus is to do with autonomic conditions and hormone secretion. It's to do with the endocrine system. The brainstem is important because it controls involuntary movements like breathing, heart rate, body temperature, etc. The cerebellum is in charge of coordination and posture. Now there are some deeper structures that are important to know. So you have the corpus callosum. It is a fibrous band that connects both the hemispheres of the brain. You have the basal ganglia, which includes the caudate nucleus, the putamen, the globus pallidus, etc. You have the hippocampus and the amygdala, which are included in the limbic system for emotions and memory. Now let's speak about the ventricular system of the brain. So you've got the choroid plexus, which produces the cerebrospinal fluid. Now starting with the lateral ventricles, you have two of them. They pass the cerebrospinal fluid to the third ventricle through the interventricular foramen, also known as the foramen of Monro. From the third ventricle to the fourth, you've got the cerebral aqueduct or the aqueduct of Sylvius. In the fourth ventricle, you've got the lateral and the median aperture. So the lateral one is known as the foramen of Luschke, and the median one is known as the foramen of Magendie. From here, it is reabsorbed and recycled through the arachnoid villi in the brain. For the blood supply, you have the internal carotid arteries anteriorly and the paired vertebral arteries posteriorly. They communicate through the circle of Willis. The paired vertebral arteries join to form the basilar artery. Here you can see the arteries contributing to the circle. You have the middle cerebral, the anterior communicating in the anterior cerebral, the posterior communicating and the posterior cerebral. On to the last part of my video, the venous drainage of the brain. So you've got the superior and the inferior cerebral veins. They drain into the superior and the inferior sagittal sinuses. All the sinuses eventually they drain into the sigmoid sinus, which drains into the internal jugular vein. Alright guys, that's it for this video. I'll see you in the next one. Take care. Bye bye.